All right. Welcome, everybody. Thank you for tuning in to our Stage 1 webinar. I'm Thea, and Anne will be our presenter this morning. We are Elation User Success Specialists, and we are excited to answer your questions today and make sure that the meaningful use requirements are clear and simple with Elation. Now, for webinar etiquette, we've muted your microphones from our end, so if you have a question, please type it into the GoToWebinar control panel window that is open to the right of your screen share. It may be hidden behind other windows, so please find it now. If you would prefer to email your question, you may send them throughout the session to events@elationemr.com. We have someone collating questions, and if your question is not addressed today, we will respond to it after the session individually. We recommend having Elation open in one tab in your browser and the Stage 1 checklist open in another, so you may reference between the two. So to this checklist. Last week, you received an email about the MU checklist that our Elation support team created. It has also been posted in the webinar chat room. This checklist can be found in our Help Center, help.elationemr.com, or by Googling Elation EMR MU checklist. Our goal with this checklist was to provide you with a means to complete all of your MU requirements with the minimum amount of steps. So for Stage 1, that's 22 steps. Each checklist action item links to its own individual page. Each page features a 15-second to 2-minute video showing the steps required, as well as step-by-step written instructions. At the bottom of the page are the individual MU requirements this action satisfies. You can refer back to the checklist after this webinar if any of the procedures we covered were unclear or if we do not cover a measure about which you have a question. As always, you can look up by CMS requirement in the Help Center by entering the name, for example, Core 7, clicking on the Stage 1 measures and requirements, and scrolling down to that specific requirement. But now to your questions. Now, Anne, earlier this week, we received a question about providing clinical summaries for patients after each office visit.
Hi everyone, this is Anne. Good morning. So I wanted to cover a couple items that we've had most questions about. And one was in this section of our checklist. It's called Visit Note. We address items that we want providers to check off for meaningful use compliance in the Visit Note. So I wanted to go over B8, which is Printing Clinical Summary of Encounter. So I have Elation open in front of me. And what's needed to be done here is whenever you see a patient and you have your visit note open, once you're done seeing the patient, before you sign off on the visit note, you must click on the Print Clinical Summary of Encounter. And really, even if you're not, completely done documenting everything and charting everything in your visit note, as long as you have your assessment and plan section as well as instructions filled out for the patient, that's what's sufficient. So you can put in, diabetes, order HbA1c tests, then click Print Clinical Summary of Encounter. You can simply click Print on that, and that's what's needed for this requirement. And make sure to always click on this button before you sign off on a visit note.
Great, thanks, Anne. The next question we've just received is about generating patient lists by specific conditions.
Great. So for generating patient lists by specific conditions, it's under one of the tasks to do once. And you'll see that in your MU dashboard. This is one of the measures that has checkboxes located right next to the measure, claiming that once you're done satisfying that measure, you can simply check off that checkbox. So heading over to generating patient lists. And feel free to follow along in our Help Center as well and clicking through the checklist. So in order to generate a patient list by specific condition, you can go to the report section inside Elation and click on patient list. And right here, we have this great tool where you can search by specific active problems that patients have, and it'll give you a list of patients with that active problem. And for meaningful use, what you need to make sure is here is to make sure who are patients of, your own name is selected right here. And then under active problems, depending on really what your scope of care is and knowing what are the most prevalent diseases your patient population has, you would put in that active problem here. So I know, for example, diabetes is a common one. So I'm going to select one with the appropriate ICD-9 code, and that's all you need to fill out here, and click search. And now this patient list will show results of the list of patients that have diabetes who are currently in my patient population inside Elation. And this is it for meeting D2 in the checklist. But also another step needed here is to take a screenshot of this in order to keep for documentation purposes to show later for CMS in case of an audit that you did indeed do this patient list search.
Great, so another question, they just keep coming in, don't be shy all, and how do we, there's a measure, the Core 2 measure, that asks for how do we use clinical decision support to improve performance on high priority health conditions?
Sure, so this refers to also, again, one of the tasks to do once, and it's listed in number 1 in section D of the checklist. And this is really simple. Basically, what needs to be done here is make sure that certain settings are turned on for your practice. And I'm fairly sure everyone has these alerts turned on, but just to make sure, what you need to do is at the top blue bar, you would click on Settings. And then click on Preferences. And then under Preferences, make sure that your drug decision support is turned on. So your drug-to-drug should have alerts turned on, and you can choose to change it from major alerts only, or major and moderate alerts only, or all alerts. And make sure that drug-to-allergy alerts are turned on as well. And furthermore, the other alerts that need to be turned on is clinical decision support. And these are the yellow MU clinical reminders you'll see inside your visit notes. And make sure that these are turned on. And once you check that, then you can go to your Meaningful Use dashboard and simply check off the checkbox for Core 2.
All right, and another question just coming in. We often get asked this one here, so I'm glad someone decided to ask it. How do we satisfy C13, protecting electronic health information?
Sure, so C13, so it's called Stage 1 Core 13, Protect Electronic Health Information, refers to also one of the tasks to do once, conduct or review security risk analysis. And what this is it's saying that you're required under Medicare's compliance to conduct a security risk analysis. And this measure specifically should be really given particular attention to, since CMS has really strict guidelines for this measure during potential audits. And to be clear, the security risk analysis needs to be done by the practice itself and includes steps that are outside the scope of Elation. So please be rest assured that Elation is going above and beyond what's required for an EMR system in terms of security and being secure with data, but there are additional steps that you must take as a practice. So there are two ways to conduct a security risk analysis review, and I'm sure that for Stage 1, Year 1 users, This may not have been done before, so what's needed to be done here, you can conduct it yourself by using this great CMS-approved security risk assessment tool to conduct a security risk analysis. And simply when you click on this link here, it'll take you to a government website describing you what this tool is and where you can obtain this tool and download a user guide on how to use this. But also, if you do want to have someone more official involved in conducting the security risk analysis with you, and we actually recommend that you contact a regional extension center for instructions on how to conduct a security risk analysis for meaningful use, well, you can simply click on this link right here to find your regional extension center representative in your local area. Now for stage 1, year 2 users, I'm sure for meaningful use requirements last year, you guys would have gone through a security risk analysis last year as well. But according to Medicare, you must review your security risk analysis every subsequent year. So this year, you would need to make sure that if any new processes were set in place inside your practice, to make sure to review these new processes and make sure that they're HIPAA compliant and safe.
Great, excellent. Thanks, Anne. All right, our next question is about filling in patient demographics. Not the most complicated, but an important step.
Sure. So filling in patient demographics is one of the required measures, and it's located under Section A and number 1 in our checklist. And basically what needs to be done here is once you have a patient chart open, you need to fill out the patient demographics section, and in order to do that, you should click on the patient name in the patient chart. And we've clearly laid out here what needs to be filled out for meaningful use requirements. And what needs to be done is a value needs to be selected in each of these race, ethnicity, and language fields. Now this means that you can't leave any of these as no race specified or no ethnicity specified, or just as a default select preferred language. So you can see that we have options that Medicare has required EHR systems to provide to providers for each of these links. And I know that I've gotten several questions from providers before that when they looked at the race options for some of their Hispanic patients, there wasn't quite an appropriate option to choose. But unfortunately, and according to Medicare, we are restricted to providing just these values for providers to select as an option for race. So what we've been recommending our providers to do is to choose an option that the patient most closely identifies with. And if the patient is uncomfortable answering, or if you feel a little bit awkward, choosing one of these options for the patient, then you can simply click decline to specify, and that is a valid option to choose in order to meet meaningful use here. Then after you're done with that, make sure to click save and close.
Thanks, Anne. Now, I know that Elation makes it super easy to meet some of the requirements that call for interacting with patients through something that Elation calls Elation Passport. Could you go through that sequence?
Sure. So I wanted to clarify, for stage 1, you're not required to invite patients, but we do recommend to do so because one of the measures, which is Core 12, providing a clinical summary of encounter, we do currently allow providers to either provide summaries by clicking on that Print MU Clinical Summary button, or by inviting a patient to Passport, because that way if a patient is invited to Passport, any summaries will automatically get shared with the patient. So if you are curious about how Passport is used, but I did want to emphasize it's not specifically required for meaningful use, stage 1. So in order to do so, what you would do is in a patient chart, there's a great icon for patients who are not yet invited to Passport. And it's very simple. Just need to click on this Passport icon and fill out this form that we have here. So you fill out the email address that a patient uses. So I'm going to just put in my email address here. And then put in the patient's cell phone number. Now, if you do have patients who don't have cell phone numbers available, when you click Send Invitation and Close, sorry, that was my bad. When you click Send Invitation and Close, you'll get prompted to print passport info document. When you click on this, this gives a really great high overview about what Elation Passport is and letting patients know why you should use Passport and how to sign up. And during the registration process, really the reason why we require a cell phone to be linked is because we send a secure invitation code to the cell phone. But if you do have patients, we do understand that not all patients have cell phones available or have text messaging. So we've put the invitation code right in this printout, and we would really suggest for whenever patients are in the office to print this out for each patient and give that to them so that they have the invitation code on paper available. And now when you go back to the patient chart, you'll see that this icon has changed to yellow and no longer gray. And this means that this patient has been invited to Passport.
Great, excellent. Thanks, Anne. Moving right along, we did get another question about if you could just go through the different categories that are included in the checklist and what those mean.
Sure. So we've worked really hard to put this checklist together, trying to think of what makes sense from a provider's perspective in order to comply with meaningful use. So we've kind of ordered from top to bottom the general workflow, including staff members, about what would be the easiest to do for meaningful use. So starting from the top one, a patient comes in, whether it's a private provider or staff members helping out. We do usually recommend staff members to help providers with this part, is filling out the patient clinical profile section. And in the patient clinical profile section, these are really simple items that when a patient first comes in, they should be able to provide these answers to staff members just at the front desk or anywhere regarding that before they see the provider. So I know I went over the patient demographics, but documenting allergies, problem lists, medications, and documenting its smoking status are all parts of the patient clinical profile here that staff members can help out to fill out before the patient sees a provider. And moving forward, we go through when the patient actually gets seen by a provider and things to do inside a visit note. So that's where this section is here. And all of these items listed right here are all items that you can do inside the visit note and have documented. And we recommend you to go through all these items before you sign off on a visit note. And now, for Section C, General Workflow, these are just 3 major items that we want providers to incorporate into their workflow for meaningful use. These are actually 3 items that are part of the menu measures of meaningful use for Stage 1. So it's not required for meaningful use, but for menu measures, you just need to pick out of the 5 available, just 3 that are just 3 of the 5 that are available. And then tasks to do once here are the checkboxes that you see in the MU dashboard and what's required to do for meaningful use. So let me just clarify how this looks like on the meaningful use dashboard. So this is the part where I discuss the menu set, where you need to satisfy 5 of the 9 measures. And the checkboxes here are the measures that I'm discussing where there are items that you need to do once. And once again, in the checklist, what's very helpful is when you click on each individual item, at the bottom we clarify what measure this satisfies, and if you're ever confused about what measures you should be referring to for anything on the dashboard, you can simply look at this. So for example, filling in patient demographics, it says this measure satisfies Stage 1, Core 7, record patient demographics. And now when I go back to my MU dashboard, I see, oh, okay, this means that this checklist, when I do this item, it'll satisfy Core 7, record patient demographics.
So, Anne, another question coming in about those difficult ones in our D section, tasks to do once. Could you tell me a little bit more about how to submit electronic syndromic surveillance data to public health agencies?
Sure. So submit electronic syndromic surveillance data. Let me first clarify what that is. So syndromic surveillance data is basically any data inside your visit notes. And what the government wants to do here is see whether or not a provider's EHR system has the ability to electronically send syndromic surveillance data over to the public health agencies. And they want to be able to analyze really, what are the most prevalent illnesses that have been coming up with patients, what are some trends. So in order to do so, you would need to contact your local health agency in your area. And you can simply find who your local health agency as well as their contact information by clicking on this link. And you can see here it has a directory of local health departments. And then if you click on your state, so for example, we're in California, then you can look for the department that would be closest to your area. And then once you get in touch with your local health agency, you would need to ask them first whether or not they even have the ability to electronically receive syndromic surveillance data. And depending on the public health agency, CMS recognizes that not all public health agencies yet have the ability to do so. So if they say yes, that they do indeed have the ability to electronically receive syndromic surveillance data, then you can simply get instructions from them. And if you need to send over a test data file to the public health agency, you can contact us at support@elationemr.com, and we'll help to get you a test file to send over to your local health agency. Now, if it is the case that they say no, then you need to make sure to get an exemption letter from them, where basically the public health agency will give you a letter saying, hey, CMS, we're letting you know that this provider can't report on this measure for meaningful use because we don't have the ability to do so yet. So yeah, so that clarifies on what that measure is. And on the MU dashboard, just to clarify what this measure refers to, is menu 9 right here. And if you click on this on the MU dashboard as well, it goes to the specific help article we've built out for each specific measure. So this is different from the one that's built in the checklist, just to give you even more details on what the measure is, specifying what the measure description is via what Medicare has told us, how the measure is calculated, as well as the tips to improve compliance with measure, which is very similar to the instructions that we give out in the checklist.
Great, thanks, Anne. All right, so the questions have slowed a bit, so I just wanted to make sure that everyone has been able to find the Ask Question box. It should be located to the right of the pop-up that came up, and it is called the GoToWebinar Control Panel. And you can expand the question tab so that it allows you to type questions in. We'll collate those here, and then I get to ask them to Anne. As always, you can also email to events@elationemr.com, and I'll ask those questions to Anne too. Great. So next up, Anne. Next up, Anne, is how to file an imaging result. Wait, that's a stage 2 requirement. Never fear, never fear. Let's look into M8. Ooh, this is a tough one. We get asked this a lot. Submitting electronic immunization data to immunization registries.
Sure. So I wanted to first refer this on the MU dashboard. So M8, submit electronic immunization data to immunization registries. So just to clarify, in the menu set, you need to satisfy either M8 or M9 as one of the 5 menu measures. And on the checklist here, M8 and M9 are referred to as right here in the section D, tasks to do once, number 4 and number 5. So for submitting electronic immunization data to immunization registries, if you are a provider where your scope of care does not include performing immunizations, then you simply don't need to worry about this and you're automatically excluded. However, if it is within your scope of care to perform immunizations, then what you need to do here is really similar to the syndromic surveillance data measure. You need to basically be able to test whether or not your current EHR system, so Elation, whether or not Elation has the ability to electronically send over and test immunization data file to your state immunization registry. And similar to the syndromic surveillance data measure, what needs to be done here is you need to contact your state immunization registry. And in order to do so, in the checklist, we've given you clear instructions. So you need to first click on this link where it'll list all the local state immunization registries and their contact information. So when you click on this, you'll get sent to a website that looks very similar to the syndromic surveillance, the Public Health Agency one. And then after you get in touch with their immunization registry, they'll give you clear guidance on what you need to do in order to send the test immunization data over to them. And now, similar to the syndromic surveillance data measure, not all immunization registries have the ability to electronically receive immunization test data. And if they say yes, they're able to. Once again, just get clear instructions from them. And if you need help or if you need to obtain a test data file from us, simply contact us at support@elationemr.com. But if they say no, that they don't yet have the ability to do so, then make sure to receive an exemption letter similar to the syndromic surveillance data measure from the registry and keep that as documentation just in case of CMS audits.
Great. Thanks, Anne. We are going to do a brief technology check. So for those of you that are tuned into the webinar, if you could please type one word, any word at all, into the questions box and hit send just to make sure that that capability is working still. That would be great. And as you do that, I'm going to ask Anne about how I know Elation has made SNOMED codes really easy and simple. So in documenting the problems, I know that core 3 is to maintain an up-to-date problem list. How can we do that easily in Elation?
Sure. So for documenting problems with ICD-9 and SNOMED codes, I'm sure everyone has used our problem list section before. But when you add a problem, so I really like always using diabetes as an example. When you click a diabetes ICD-9 code with a plus SNOMED icon on there, when you add that on, it will automatically link the appropriate SNOMED code that should be associated. And for meaningful use purposes, you do not actually need, the provider does not actually need to worry about attaching the appropriate SNOMED code to the appropriate ICD-9 code. That's something that we as an EHR system needs to do on our back end, but we simply made this procedure a little bit more visible and transparent to our providers by showing what SNOMED code will link to the ICD-9 here. And what SNOMED codes are, I'm sorry, I should have clarified this earlier. SNOMED codes are basically a different way of identifying a problem, and the government is really wanting to move towards using SNOMED codes in order to facilitate their organization of problems. So then once you're done filling this out, click Save, and that's what's needed to do. That's what's needed to be done here for meaningful use.
Great. All right, moving right along. Within the visit note, I know that documenting vitals, sometimes we aren't as thorough in documenting those. So how thorough do we need to be to satisfy meaningful use?
Sure. So I wanted to go over what needs to be done here for documenting vitals. And I know I get this question asked a lot. So in the MU dashboard, we will currently see 3 measures that are related to this vitals measure. And what this is if it's within your scope of care to document blood pressure, height, and weight, then you need to make sure that for every patient, or for really logistically 50% of your patients, but we ask providers to try to do this for as many patients as possible, to document blood pressure, height, and weight on each visit note. However, it may be the case that because of your scope of care, it's not always necessary to record blood pressure, or in another case, it's not always necessary to record height and weight. So that's why we've inputted the C8.2 and C8.3 exclusion measures here to clarify, hey, if you are excluded from recording blood pressure in your scope of care, just ignore what we say here in C.8 or C.8.3. Just look at the numbers, what you see here. And also, in another case, if you're excluded from height and weight, then you should always refer to C.8.3 to see how well you're doing. But if in any case you're not excluded from any of these criteria, then you should make sure to always refer to C.8. And I would say, just to mitigate confusion, don't ever refer to C.8.2 or C.8.3.
Great, excellent, Anne. I know that Elation has some specific features that actually help users meet MU requirements at a proactive level. Can you tell me about some of those warnings that pop up and what those mean?
Sure. So I wanted to go over addressing clinical reminders, which is documented right here, B visit note number 2. Let me pull up the patient chart. Great. So when you open up a visit note, I'm sure everyone has noticed, but you'll see this yellow bar at the top saying MU clinical reminders. And we also put in the number of clinical reminders that's going to be needed here. And what the government wanted to do was to make sure that EHR systems have a way to remind doctors about specific items in their patient care they should be reminded about. So for example, we have one reminder here that says document list of patient's current allergies. So obviously this is a new patient and I haven't yet documented an allergy yet. So in order to do this, I would click address, and then we simply prompt up a new text box that says, hey, document your patient's current allergies. And if it is the case that your patient is not currently does not currently have any allergies, you can click NKDA, which also stands for no known drug allergies, or you can add the patient allergy that's needed here. So let me just add in hydrocodone, hives, safe. Great. And not only do these clinical reminders help you really with your patient care, but as you address these reminders, you'll also be meeting several meaningful use requirements. So it's a great way to not only help your patient care and workflow, it also helps you to meet and satisfy your meaningful use requirements as well. And if it is any case that one of these reminders just do not seem necessary or pertain to your scope of care or to the specific patient you're seeing, you can simply click dismiss. So for example, not everyone may administer flu shots this season. So then you can click dismiss, and then that reminder will disappear. Great. And now, since we're already within the visit note, I know that I've gotten questions about what is this section that says questions for meaningful use compliance. And what we wanted to document here is that for meaningful use, whenever your patients are referred to you, or whenever you refer a specific patient out to a different doctor or setting of care, meaningful use asks you to document this inside a visit note. So, for example, let's say that you've got a new patient in today who was referred from another doctor. Then logically, you need to make sure that medications are reconciled, and you should know what the current medications a patient is taking. So while you're filling out your visit note, you should make sure to say, for transition of care, this patient came from another setting or doctor. And now, as you go through your current process of reconciling medications and asking the patient about what their current medications are, you should click yes to say, yes, I've documented all the current medications the patient is on, and then sign off on the visit note. However, it may be the case that your patient needs to be seen by a specialist, or your patient needs to be referred to another doctor or setting of care. Then you should make sure to check off 2 other setting or doctor, and we clarify what we mean here with this black text box that comes over whenever you hover the text. And the current medications is not applicable here. And what really needs to be done is to make sure that a summary of care record was provided to this other doctor. And once that's done, whether or not you've faxed over a summary of care record to this other provider or use our letters features to send over the patient's clinical profile, you click yes and then sign off on the visit note. And now when you sign off on the visit note, you'll see that under the meaningful use section here, it clearly notes that you documented for meaningful use purposes that this patient was referred to another setting of care, and this other referred doctor was given a summary of care record.
Great, excellent. Thanks, Anne. Moving right along, we've had questions about providing patient education handouts, and I know that flu season is around the corner. So how can we use influenza vaccination handouts, let's just say, to help our doctors meet their MU requirement?
Sure. So providing education handouts is one of the menu measures, and as I said before, you only need to satisfy 5 of the 9 menu measures listed in the MU dashboard. So let's say you're seeing a patient, you're administering a flu shot, and along with the flu shot, you want to make sure to provide a handout about the flu shot that you just received. So now when I have this visit note open, it's very convenient. You can either click on this gray action bar at the top and click on handouts, or you can click out handouts inside your visit note as well. So I'm going to go ahead and click on the button inside the visit note. I'm going to scroll down to choose a handout that I want. And for this handout section, if there are handouts that you want to be able to use inside Elation, you can simply upload them directly here by clicking Upload File and uploading the handout you want to use. And that way you'll always have that available inside Elation. But let's say I administer a flu shot, want to give this to a patient. I click on the handout I want, and will automatically prompt you to another screen with a copy of the handout to print out for the patient. Now once that's done, you'll see now that under Care Plan, the fact that you gave this handout to the patient will be documented here, and that's what needs to be done for meaningful use. And make sure that you always do this before you sign off on a visit note. And as well, what's great is that once you have this handout given, when you also provide the clinical summary to the patient, it'll also be listed under their instructions saying that, hey, I gave you a handout, make sure to look over that.
Great, thanks, Anne. And to walk through another exercise, let's say we don't know where the measure that we're trying to meet, where it's located in the checklist. How could we find the requirements needed for, let's say, C5 if we didn't know exactly the article to go to in the checklist?
Sure. So, as I showed before, on your MU dashboard, if you're curious about how to meet a certain measure, or if you're just looking through a dashboard and you don't know exactly what it means when it says record adult smoking status, or let's do something that's a bit more confusing looking, so protect electronic health information. So I go to this, and on your MU dashboard, you can simply click on the link, and it'll direct you to the Help Center article that specifies what this measure is about. And I really recommend to read thoroughly through the tips to improve compliance with measure. It's really similar to what we have listed out on the checklist. So the instructions you'll receive will be pretty much similar to what you get in the checklist, but the checklist is a little bit more thorough. So that's another way that you can get a little bit more guidance directly through what you already have inside Elation.
Great. Thanks, Anne. Searching for another question here. Again, we want to thank you all for tuning in. And as always, when you do have questions about meeting your MU requirements, you can always email support@elationemr.com. Oh, we've had another question pop in about, they've changed their answer. Another question pop in about documenting patient smoking status. Could you go over that one more time, Anne?
Sure. So for documenting patient smoking status, let me go back to the checklist, just refer to where that is. It's located under Section A, Patient Clinical Profile. And as I said before, Section A, Patient Clinical Profile is something that the staff members can really help out and fill out before the patient actually gets seen by the provider. So once I'm inside the patient's chart, there's a smoking section under History. You click on Add Smoking Status and choose the one of the options that most appropriately is close to whatever the patient lets you know about their current smoking status. So let's say I never smoked. Then that documents that this patient was never a smoker. And if you do want to edit this text even more, then you can go ahead and choose from any of the options again if you do want to edit it. Now, another way to do this is, let's say, really part of your workflow for asking the patient about the smoking status happens when the provider actually sees the patient. Then, when you're inside your visit note here, the clinical reminder isn't here anymore. That's because I already addressed the smoking status. But usually, you'll see a clinical reminder here that says, hey, you should document this patient's smoking status. And you can simply click Address, and it'll prompt you the same screen that we just saw before about adding a smoking status for the patient.
Great. Thanks so much, Anne. That was super helpful. So with that, we'll wrap up this webinar, and thank you all so much for tuning in. Any questions that we did not get to today, we'll be sure to answer via email. At this time, you should bookmark the Stage 1 checklist for future reference. And as always, you can reach out to us at support@elationemr.com at any time with any of your questions. Thank you for using Elation, and have a wonderful day.